Mounjaro, with its active ingredient tirzepatide, is a medication that has garnered significant attention in the medical community. It was primarily designed to help people with type 2 diabetes manage their condition more effectively. Specifically, Mounjaro helps to manage blood sugar levels, keeping them within a healthy range. This is crucial for preventing the serious and potentially life-threatening complications associated with diabetes. Its main job is to support those whose bodies struggle to regulate glucose, a common issue for individuals with type 2 diabetes, helping them lead healthier lives. However, Mounjaro has also gained attention for a striking side effect that has captured the interest of a broader audience: weight loss. This unexpected benefit has sparked conversations far beyond the diabetes community. This has led to a surge in off-label use, meaning people are using the drug for a purpose other than what it was originally intended for. Specifically, it's being used by people without diabetes who are drawn to its weight loss effects. They are hoping for an easy solution to weight struggles, seeking a quick fix to achieve their desired body image. But using a drug outside its intended purpose is risky, and it's essential to understand the potential consequences. This is especially true when it's only been tested in diabetics, as the effects on non-diabetics may not be fully understood. The body of a non-diabetic works differently than that of a diabetic, with different metabolic processes and hormonal balances. Therefore, introducing a powerful medication like Mounjaro into a non-diabetic system can disrupt that delicate balance in unpredictable ways, potentially leading to unforeseen health issues. Before considering it for weight loss, especially without a diabetes diagnosis, it's crucial to understand the real risks involved and have an open and honest conversation with a healthcare professional. It's important not to just see it as a miracle fix, but to approach it with a realistic understanding of its potential effects. Mounjaro is a serious medication, not a shortcut to achieving your weight goals, and should be approached with caution, thorough research, and full awareness of the potential implications for your health. Mounjaro works, and its mechanism is quite fascinating. It achieves its effects by mimicking two crucial gut hormones that play a significant role in how our bodies process food and regulate energy. These are GIP and GLP-1, both incretin hormones that are naturally produced in the gut. They help control insulin release and blood sugar levels after eating, ensuring that glucose is properly utilized by the body. For individuals with diabetes, where blood sugar control is often impaired, this medication boosts insulin production, helping to compensate for the body's inability to produce enough on its own. As a result, it effectively lowers blood sugar levels, bringing them closer to a healthy range. This is exactly what they need to manage their condition and prevent complications, but these hormones also have other effects on the body. They slow down the rate at which the stomach empties its contents into the small intestine. This, in turn, can reduce appetite, making you feel fuller for longer periods. Ultimately, this can lead to weight loss as you consume fewer calories. However, in non-diabetic individuals whose blood sugar regulation is already functioning normally and efficiently, this artificial boost from Mounjaro can potentially throw off the body's delicate and carefully maintained natural balance. The appetite suppression might seem tempting as a quick fix for weight loss, but it comes with a risk that should not be taken lightly. The risk of disrupting healthy metabolic processes, which are essential for overall well-being. What helps a diabetic manage their condition effectively can potentially harm someone who doesn't have the condition and whose body is functioning as it should. Therefore, using Mounjaro solely for weight loss purposes means tampering with a system that isn't broken and doesn't require fixing. In such cases, the risk can easily outweigh the perceived benefits, making it a potentially unwise decision. The biggest danger for non-diabetics using Mounjaro is hyperglycemia, dangerously low blood sugar. In diabetics, lowering blood sugar is the goal, but in healthy people it can drop too far, too fast. Symptoms like shakiness, confusion, and even loss of consciousness can strike without warning. Unlike diabetics, most off-label users aren't trained to recognize or treat these emergencies. This lack of preparation makes the risk even greater. Blood sugar regulation is delicate. Meddling with it unnecessarily can have serious consequences. Mounjaro is not a casual weight loss tool for non-diabetics. It's a potential hazard. What's therapeutic for one can be dangerous for another. Mounjaro's side effects go beyond just blood sugar regulation. It's important to be aware of the potential downsides before considering this medication. They're often gastrointestinal in nature, affecting the digestive system significantly. Nausea, a feeling of sickness and the urge to vomit, is a common complaint. Vomiting, the forceful expulsion of stomach contents, can also occur. Diarrhea, characterized by frequent and loose bowel movements, is another potential issue. Constipation, the opposite of diarrhea, involving difficulty in passing stools, can also be experienced. And stomach pain, ranging from mild discomfort to severe cramps, is frequently reported. These issues stem from slowed digestion, a direct consequence of how Mounjaro affects the digestive process, which can be especially harsh for healthy users who may not be accustomed to such digestive disturbances. For some, the discomfort is so severe, it significantly impacts their daily life. It outweighs any weight loss benefit, making the medication not worth the unpleasant side effects. More serious risks include pancreatitis, a potentially dangerous inflammation of the pancreas, and gallbladder problems, which can require medical intervention, which can be life-threatening if ignored, requiring immediate medical attention. Without medical supervision, these risks are even greater. These dangers are magnified as there's no professional to monitor your health and adjust the dosage if needed. Enduring weeks of nausea or pain is not something to take lightly, for weight loss is a steep price to pay, especially when considering the potential long-term health consequences. The reality of side effects is something that needs to be considered, is often far from the promise of an easy fix, and can lead to significant disappointment. Using Mounjaro off-label without a proper diagnosis means accepting risks you may not fully understand and potentially endangering your health. Perhaps the biggest unknown is what happens after years of Mounjaro use in healthy people. There's simply no long-term data. Animal studies raise concerns about thyroid tumors, and other risks may emerge over time. Without a doctor's guidance, users miss crucial warnings and health checks. Responsible medicine means weighing benefits and risks with a professional, not gambling with your health. Mounjaro is a vital tool for diabetics, but for others the dangers are real and the safety net is gone. Before considering off-label use, talk honestly with your doctor. Your health deserves more than a shortcut. It deserves expert care and caution.